clear expectation setting is so important because, again, if I don't expect something to work for 2 weeks, then it's important that my patient understands what they should be looking out for. So sometimes I tell them it's going to feel better before it looks better.
Welcome to That's Derm Good. I'm Janelle Ball, and I'm excited to bring you thought-provoking conversations about biologics, specialty medications, treatments, and so much more. I'll be chatting with some amazing guests about access, affordability, and advocacy. You're really going to enjoy this show. This episode is sponsored by Dermavant. Welcome to That's Derm Good. Today, my guest is Dr. Elizabeth Kiracofe. She is the founder and CEO of ARIA Comprehensive Dermatology. Welcome.
Thanks so much, Janelle, for having me.
Yes. So I am so excited to talk to you. I was looking at what you've done in the past, and I saw that you were a third grade teacher.
Yes,
And
this is a little known fact. Yes.
Yeah, that is amazing. That means you've got to have a lot of patience.
Yes, which we need in dermatology as well.
Absolutely. So I'd love to hear if you could share your journey from being a teacher, also a lobbyist, and to becoming a dermatologist and the founder of ARIA Comprehensive Dermatology.
Yeah, for sure. So I remember sitting down with my med school dean and telling her that I wanted to defer my acceptance to med school because I wanted to test out being an elementary school teacher. She was so encouraging. And at the same time, she was like, Elizabeth, are you sure? Like, you just took biochemistry. Like, this is one of the hardest classes in all of medical school, and you took it in undergrad. Like, having a year, setting those things apart. Like, are you sure that's something that you want to do? And I was like, wow, you bring up an extremely good point. And also, yes, I do want to do this. Both of my parents were public school teachers, and they're both retired now, but I grew up with education in my life, and I loved teaching and college and taught part-time at a preschool. I just love kids and love teaching. And so I was also like always very torn between like dermatology and pediatrics. And then I was sure I wanted to be a peds derm. And, my life is a series of twists and turns that landed me in exactly where I needed to be. But yes, I deferred my med school acceptance to teach third grade. And basically what I decided is that was a decision that was really important for me to make before I went to medical school, like before I had studied for 4 years and win $250,000 in debt, that I for sure wanted to be a doctor. Because if I decided I wanted to be a third grade teacher after medical school and all of those things, then that was the wrong way to do it, because that would have been a really expensive way to make that decision. And so I loved my students and I loved teaching. I had an amazing mentor who was a family medicine doctor. And he said to me, EB, which was my nickname for Elizabeth, EB, if you want to be a teacher, when you're a doctor, you're always a teacher. But when you're a teacher, you can't also be a doctor. It's kind of illegal. And so I decided I wanted to have my cake and eat it too. And in that moment, after all of this like tough decision and back and forth, and what am I going to do? It took me 1 second to be like, oh, of course. Well, then, of course, I'm going to med school. Also, other career paths, I actually worked for the American Cancer Society. I was their Hispanic outreach coordinator down in the Orlando metro area in Florida. And I worked as a consultant for an international aluminum company. And then while I was in med school, I, as you mentioned, became a registered lobbyist for the state of Ohio, advocating on behalf of the physicians for the state of Ohio. And it's interesting, all of those things I still do in some way today. And I just do them kind of under the umbrella of being a dermatologist.
Wow, that is so amazing. I love that. It's so true. You, as a dermatologist, you also are a teacher. And I think that's great for patients anyways, because when you're going to the doctor, you need to be taught how to take care of your skin and how to take your medications properly. And there's so much that goes into it. That's such an important aspect of being a provider and educating your patients. But I love that.
And I'm sure what you know is the same as me, is patients want to know why. It's
Yeah.
so important to understand why
Hmm.
they're being asked to do something. And I think one of the hardest things in dermatology is adherence, because it's not always as simple as just taking a pill, right? Sometimes we're asking people to put on a cream and only one cream on certain areas and this cream on other areas. And sometimes, you have to use 2 or 3 creams if you're fixing a problem. I think it's so important for patients to understand that there's a very specific reason that we're making each of the choices that we are when we make our recommendations. And there's so much more likely than to be like, oh, I get it, and I'm going to follow through on this. And I don't believe that patients ever don't follow through because they just don't care or don't want to. But there's a lot of things that life asks of us. And
Right.
when like putting on a greasy cream is like not that fun, somebody better tell you why it's really important and help you understand that.
Yeah. Well, I feel like there's so much information now that we have access to just on the internet in general. So people are having questions. They have these concerns and they want to know, okay, well, why did you write this? They come to the doctor so that they can get something resolved. For you to go into an appointment and say, I've got this rash and, I need to know how to fix it. But then you prescribe something and then they're like, well, I put it on one time and it seems like it helped. So now I'm done. Why is there an importance of continuing that medication as you prescribed it versus just saying, oh,
Mm-hmm.
okay, now it's done and they can kind of walk away. So I think it's so important to have that educational aspect and making sure that we know. But, like I said, there's so much information available now that people are becoming more
Yeah.
aware.
They come in, they're well informed, they've often like done some homework. And I love when patients like bring things to me, because some of them are really relevant and then some of them are very bad information, because like
Mhm.
newsflash, not everything on the internet is real.
Right.
And not every person that writes a blog post about their skin and what helps
Yeah.
their skin, works for someone else's skin. And,
Hmm.
when I reflect that back to patients, they're kind of like, oh, like, duh,
Hmm.
right? And like they get it, but in the moment, they're like, oh, but her skin looks so great. And like, if she used this,
Hmm.
then I must use this. And I'm like, but you
Right.
can't use that. You have eczema. This actually is not a good fit. And the other thing you mentioned too were expectations. And so I
Hmm.
think clear expectation setting is so important, because again, if I don't expect something to work for 2 weeks, then it's important that my patient understands what they should be looking out for. So sometimes
Hmm.
I tell them it's going to feel better before it looks better. But we need to use your medicine sometimes even a week after it's looking better. So that is a part that I think comes from having a background in education, is being very precise about those expectations and telling patients what to look for, because I might just stop as soon as
Hmm.
it got better. And if I didn't understand why it was important to continue.
So what do you do about questions when it comes to like more of a holistic approach? Because I feel like you see so much of that now where it's like, don't eat this food because this will cause this inflammation, or this is what's causing your psoriasis. There's so many just pointed messaging on like Instagram and Facebook. Even my feed, I see so much about like, this is an eczema treatment and this is why your eczema is getting worse and this is what you should use now, and it's plant-based. So there's just
Mm-hmm.
so much information on there. But when people have questions about, okay, I can cure this with my diet, how do you educate patients on the importance of maybe both? I mean, maybe their skin is completely inflamed and just changing your diet right now may not fix all of the damage that's been done for years and
Mm-hmm.
years.
Yeah, and it's a great question. And it's a question that I get all the time. And my first response is like, I wish that there was just a simple diet change that we could make that would solve this. And unfortunately, we know there's been a lot of research into this, a lot of research into special diets for psoriasis and acne and other inflammatory conditions. And there isn't tons of very discrete evidence, like if you stop exactly this, then this will happen. And so what I tell my patients is that it's more of a general feeling. We know that foods that have what's called like a high glycemic index, so foods that like break down into sugar more easily, are more likely to cause inflammation. And that's true when it comes to acne. And that can also be true with things like eczema and psoriasis. But it doesn't mean that like you have to give up all sugar or give up carbs, because if you did that, it still wouldn't cure your psoriasis. And
Hmm.
so what I try to help my patients understand is that it's a balance, right? So if you're eating lots of packaged foods, if you're not spending much time shopping in the produce section, then increasing your time shopping in the fresh food section, in the produce section, can decrease the inflammation because you're eating less processed foods. And so, in what we know about diet and skin conditions, is we haven't found the cheat code yet. But we do know that some foods are more inflammatory than others. And so, by decreasing foods that cause more inflammation in the body, it never hurts. It's kind of like squeezing lemon juice into a paper cut. Like, did the lemon juice cause the paper cut? No, it was, the paper cut was already there, but if you squeeze lemon juice in it, it doesn't help. Like, let's avoid things that we know cause an increase in inflammation in the body. And then that will allow the body to heal, or the paper cut in this metaphorical example. Then patients can understand it's not the food that caused the problem. So therefore, solving the food 100% is not going to take the problem away. But there are things about foods and about choices that we make that can make the problem worse.
Yeah, that's a really good analogy. I love that. See, that's the teacher in you.
Yeah.
Can come up with the really good analogies. I feel like teachers are very creative in coming up with different ways to educate, and I love that. That's so good. So, as far as what all ARIA comprehensive dermatology entails, so you are speaking about just inflammatory conditions. What else do you encompass within your practice?
A large majority of my practice are patients that have inflammatory skin conditions. So I say it's anything that makes your skin inflamed and annoyed. So that might be eczema, psoriasis, acne, even hair loss. Also, things that make the skin inflamed, but you don't see the inflammation, like vitiligo, which is a process of inflammation that takes away the pigment producing cells. Those are kind of the primary things, like why patients will seek me out. And then I also have a lot of patients that just see me for their normal full body skin check. And I see so many patients who are, I guess I would say, adult women. I can still consider us young women. I mean, I'm in my 40s, but I still feel like a young woman.
Yeah.
But women in their, 30s to in 40s, sometimes late 20s, even to early 50s, that are getting acne for the first time. And it's just so upsetting to them because they never had acne growing up. And
Mm,
now all of a sudden they're getting acne and they're like, but this never happened to me before. And I was like, I'm so sorry, because when we're in our teens, like, people expect to have acne, right? So you
hmm.
think if you've escaped teenager, you've
Yep.
escaped your early 20s and you haven't had acne, then why would you think you're going to get it? And I think it's this
Yeah.
great myth that, like, no one tells us when we're younger that, like, when you're an adult woman, there's another spike of having acne that's due to our hormones. And so that's also a huge portion of my practice because I'm a young adult woman. So I think I see a lot of young adult women that are having acne. And so acne knows
Yeah.
no bounds and no age limits.
I have learned that.
Mhm.
Well, I grew up, had acne all my like teenage years and then, into my 20s and now I'm early 40s and I'm like, why am I still breaking out? What is going
Mhm.
on? And there's a lot of questions about that. Like, where's that going to end? Or is there an end in sight? Those
I
are my biggest
know.
questions.
Exactly. I know. And I think that's what's so hard about it is that you already feel like you've paid that toll, right? You
Hmm.
had acne as a teenager. I also had acne as a teenager. I was on Accutane 3 times, and like I had like serious acne when I was younger. The unfortunate answer is that sometimes I'm still taking care of women into their early 50s that have acne. It's not an age limit. It's a function of our hormones and kind of
Hmm.
like how they're settling. And with patients, sometimes
Hmm.
there's like really easy, low hanging fruit of like, oh, I'm like moisturizing with avocado oil on my face every night. I don't understand why it's not fixing my acne. And I was like, well, as a matter of fact, I don't think it will fix your acne. And they're like, what? But it's all natural. And I'm like, yes. And there is nothing about all natural that means that it's better, right? It would be all
Mm-hmm.
natural to give someone who's allergic to peanuts peanut butter, right? Just because it's all natural and vegan and
Mm-hmm.
gluten free, like doesn't mean it's the right decision. Also, all natural to squeeze lemon juice in a paper cut, but as we have discussed, not a good idea. But I have a lot of my patients that come in that are using some sort of like all natural product. And the tricky thing is not all natural products are bad by any means, but there is
Mm-hmm.
no FDA regulated definition of what all natural means or what organic
Mm-hmm.
means when it comes to skincare or what the word quote unquote clean means. That definition is created by the company. There may be some like light industry standards, but clean is not a term that is across the board. And so that's really important for patients to remember because they think if they're using an all natural product or if they're using something that's clean, that it shouldn't be causing a problem. And
Mm-hmm.
often when I look at the ingredient list, I spend so much of my day looking at ingredient lists of products. And sometimes those all natural extracts are just delivering too much irritation to allow them to be able to stay on a skincare routine. Again, it's not that those things that they're allergic to them or that they're problematic, but their skin sensitivity is not allowing them to use that product effectively. So I always like to educate about what all natural or clean means within the
Mm-hmm.
beauty spectrum, because that doesn't mean that it's better. And the other thing is sometimes less is more. I often have patients come in that are doing like a 7-step morning routine. And that's not unusual. And if you're doing it and it works for you, I am so happy for you. It also
Mm-hmm.
probably means that you don't end up in my office asking me for help. And so I have a bias, right? As we all do when we take care of patients, is we see the patients that come to us, right? We see
Mm-hmm.
the patients who need us. And your question was initially, when is adult female hormonal acne going to end? And my answer is, I don't know. I'll let you know when it ends for me. But the important thing is also understanding that it's not something that you should be able to figure out yourself. Like if you're a
Mm-hmm.
woman listening to this podcast and saying, gosh, I've been struggling with this for so much time and I've tried this and I've tried that, my question would be is like, have you tried seeing a board certified dermatologist? Have
Mm-hmm.
you tried seeing a dermatology professional that is specifically trained to do this? Because the other thing I see that breaks my heart is that patients will come in and they've spent like $700 on the Sephora sale. And they have
Mm-hmm.
all of these products, but they're using something in the morning that really should be at night. They're combining two products that shouldn't be. And overall, they just don't have like maybe the right game plan for them. And so that kind of breaks my heart. And then secondly, I see patients that are like, Doc, I'm so sorry. I don't know what's going on. I can't tell you why I have this rash. And I'm like, well, if you could tell me why you have this rash, it is super silly that I spent so much money to go to school and like took 14 years of my life, in education, because if
Mm-hmm.
you could tell me, where's my job
Right.
security, right? Like I'm supposed to tell you how to fix this
Mm-hmm.
problem. But I think sometimes because our skin is like discussed on podcasts or it's discussed in magazines or it's discussed in blog posts, Instagram, Facebook, TikTok, you
Mm-hmm.
name it, our patients feel like they should be able to
Yeah.
solve it on their own.
Yeah.
And a lot of skin disease is quite serious. And also, even things like acne, which I would argue is serious and can lead to scarring and things like that, but it also can be very complicated because sometimes it's not just acne, it's acne plus rosacea plus
Mm-hmm.
seborrheic dermatitis. And when those things are happening together, it's no wonder that, a couple over the counter products aren't doing it.
Yeah. So, biggest takeaway here is stop self-diagnosing your skin. Seek a professional.
And
I mean,
stop putting food on your
yeah,
face.
right.
Stop putting food on your face. That would be another
Yes.
important takeaway.
Okay, so speaking of food, that makes me think of I've been seeing these ads about seborrheic dermatitis and stop using coconut oil because it actually feeds the bacteria. Is that true?
So I would say of all oils, the most research has been done on coconut oil. And so my least offensive oil is coconut oil. It is still
Mm.
not something that I recommend, but my colleague and dear friend, Peter Leo, has written some papers on the benefits of coconut oil and even sunflower oil in patients that have eczema. And again, the thing to realize here is that in general, we're not talking about the face in those categories. And so, no, there is no coconut oil that goes on my patients' faces, 0%. And what I tell my patients is that even the natural oil that they create, when you're sweating and you're post workout, that's the natural oil that you're creating. That is like Thanksgiving dinner for the yeast and the malassezia that cause your seborrheic dermatitis to get inflamed. And then putting additional oil on that, which sometimes feels like the right answer. And I understand why people do it. It's because there's flakiness and it
Hmm.
appears to be dryness. But that flakiness is actually driven by an overproduction of oil and inflammation. So if we are using oil to combat that, it's like we can't ever get the ball rolling
Right.
because we're just giving our yeast Thanksgiving dinner. And who wouldn't invite their friends to that? So then they just recruit all their friends, and the seborrheic dermatitis is harder to get under control. There's one prescription oil that I do have some patients use for treatment of seborrheic dermatitis. But again, that's just a prescription and specifically in select patients who need that.
That's such good information. I feel like there's so much that you can learn. Just being able to go and have that conversation, if you have those questions, is so important to figure out, okay, what should I do about my skin before going in, self-treating or self-diagnosing? Because you just never know. Everybody's skin is different and it reacts differently to different things. So it's important to seek the help from a professional that
Mm-hmm.
went to school for this and knows all about it. That's great.
It's fun. And I think the other thing is too, is that sometimes, even with our colleagues in like primary care and family medicine, 33% of their visits include some sort of skin concern. And
Mhm.
I can't imagine if 33% of my patients were asking me how to titrate their blood pressure medicines or how to treat their diabetes, right? But
Mhm.
then they get asked a lot of questions about skin. And so I also tell my patients, to think about like, yes, your primary care doctor is brilliant. Like, I mean, I chose dermatology because primary care would have been way too overwhelming for me. They have to know everything about everything. And also, it's not fair to expect them to be the best at the skin, right? Just the
Right.
same way you wouldn't expect me to be able to titrate your blood pressure medicines or your insulin dosage. So, also, if you're seeing your primary care doctor and things are getting better, but maybe they aren't quite where you want them to be, it's okay to like see a dermatologist. It doesn't mean that you don't trust your doctor, they're not doing a good job. It's just that they have so many jobs to do. And
Mhm.
sometimes if they have to address multiple things in a visit, it's just hard to give the skin the attention it deserves. And so, and I also know that my colleagues in primary care are like, oh, I didn't want to send you like something so easy, like eczema. And I was like, please send me the eczema. Like I would much rather see it earlier before it gets bad. And so,
Right.
for any patients listening, I always recommend, if you have a skin problem, sometimes it can take a little bit to get in with a dermatologist or a dermatology provider. So go ahead and make that appointment. And then if
Mhm.
you and your primary care doctor solve it, great, then you can cancel your appointment. But what you don't want is to have to start that 3-month wait to get in after you already know your treatment plan's not working. And
Right.
so that's kind of one of my life hacks of skin outside of dermatology. And when you're thinking about it, is just to recommend to have your patient schedule that appointment a little earlier. And then if you get where you're going and you don't need the dermatologist, it's okay. Our feelings aren't hurt. Just please just let us know so we can,
Right.
have someone fill the spot. But at least you have that appointment if you need it.
So you're a national expert on inflammatory skin conditions like HS, so hidradenitis suppurativa. Can you explain that condition? Tell me like what you're seeing with that and the treatments that are available, because I know that there's some new indications for some drugs that have been out, more and more treatment options that are available, which I think is really amazing. But I don't think it's something that's widely talked about.
Yes, you're 100% right. And I love that you asked this because seeing HS patients in my office is like, I get so excited because it takes 5 to 7 years for these patients to even get an accurate diagnosis. If you're listening and haven't heard of hidradenitis suppurativa, we refer to it HS for short for obvious reasons. But what it is a skin condition where the immune system kind of reacts on the hair follicles. And it's commonly in the hair follicles under the arms, under the breasts, in the groin. It can happen to both men and women, a little higher prevalence in women. And this condition causes abscesses and pimples and kind of situations where there can be draining of fluid from these areas. And what is just so terribly difficult and sad for these patients is because they're happening in sensitive areas, under the
Mm,
arms, under the breasts, in the groin, they often don't say anything about it, right? They often don't bring it up to their doctor, and patients start to think it's a them problem.
mm,
And so then they start changing their soaps and they start washing more and then they start, doing these things. And then often these patients will show up into the emergency room when things have gotten so bad. But in fact, it has nothing to do with the patient and it has everything to do with their immune system. And their immune system is attacking these glands that are causing them to overproduce inflammatory fluid. And
mm,
so if you were to look up hidradenitis suppurativa online, you would see these like draining sinuses and a lot of purulence and pus. But what's critically important to know is if you were to swab that area and send it to the lab and look for bacteria, there's no bacteria there because these
mm,
pustules and abscesses are sterile because it's not a function of how clean the person is. It's not a function of how well they're taking care of themselves. And that's what people think. And that's what breaks my heart is that that's what people think is the problem. And I had one patient one time, and she was only taking jobs that offered smoke breaks. She did not smoke, by the way, and that were within 10 minutes of her home. And the reason she did that is because 3 times a day she was allowed a quote unquote smoke break, which she would use to jump in her car, drive home, take a shower, put on a new shirt because her HS was so bad, it was draining from under her arms onto her clothing. And she was so worried that someone would see it or and ask a
mm,
question or that they might be able to smell it. And she lived so long thinking that this was her fault and something that she was doing wrong when it was nothing that she could control. And now there are a few biologic medications for HS, but why I love seeing them is that often when they come in, sometimes they don't even know the right diagnosis. They've just been told it's
mm.
an abscess or a boil. And so public service announcement, if you are listening to this and you have had more than one abscess or boil underneath the arms or in the groin or under the breasts or anywhere on your body, or you experience consistent drainage, number one, it is not your fault. Number
Mm.
two, it is your immune system that is attacking it. Number three, you need me or some, doctor in dermatology to help you get the right medicine because you can't solve this problem without us. And we now have medicines. Like finally, hidradenitis suppurativa is like getting the press it deserves as a disease state
Mhm.
that's absolutely devastating for patients. And now we have a lot more support and a lot more treatments to offer these patients, which is just so exciting as a doctor because there were things that we could do before once the patients finally got to us, but they went misdiagnosed for so many years. It's an exciting time to be a dermatologist because we have the opportunity to now have medicines that can help these patients that for so long just haven't had anything good that we could offer them.
Yeah. This episode is sponsored by Dermavant. I remember the first time I saw a Cosentix commercial and it was for HS. And I was like, what? This is new. Like, I bet people are probably watching it like, what the heck is that? What does that even mean? But I was so excited to see that because I'm like, okay, there's some awareness that is growing around this. Like you said, it's probably been misdiagnosed for years and years.
Hmm.
And now there's finally more options for patients. And I love that there's support there. I'm sitting here thinking, I'm like, I probably would have been bawling in that office with that patient after she, was treated and was like, oh, this is not my fault.
My team says that sometimes we have like a high cry ratio. Usually it's happy crying, right? Like
Yeah.
I've been to so many places, and every dermatologist, knows how to diagnose, HS. And also sometimes the patient just doesn't show you, right?
Hmm.
Or sometimes they're getting their like diagnosis and treatment from urgent care or the emergency room. And so if I have any urgent care or emergency department, EM physicians listening to this, like HS, please send those patients to us because we have so many, additional treatment options now that are coming out. There's just so many great options.
Yeah. And that makes me think about that collaboration too, though, with the primary care physicians. How important is that for you as a dermatologist to collaborate with these primary care physicians and, in emergency or urgent care physicians so that they know when they see something like this, who to send it to instead of trying to treat it and not necessarily being able to fully treat it properly for the patient?
Yeah, for me, it's critically important. I mean, and I think everyone that's in the specialty of dermatology, knows how important it is, that we partner with our primary care colleagues. And I always tell my patients, I refer out to primary care probably as much as they refer to me. Because I tell my patients, your primary care doctor is the quarterback of the football team. You've got to have the quarterback. I'm a really good wide receiver and I catch a lot of passes and run for a lot of touchdowns, but I am not the quarterback. They need to know everything that's going on the field. They need to know everything that is happening in the game, and they need to understand how those pieces are moving around because they impact one another. Because of that, I do a lot of work. So I teach all the primary care residents in Chicagoland with our community hospital. And then I also do grand rounds at a lot of hospitals for primary care and for emergency medicine. And I really love being invited to give those talks because I think it's so needed. And I know that it is because of the number of people that line up like after I've given a lecture that are like, hey, could you look at this picture of this patient? Or, hey, I saw someone and I did this, but I actually think now that I've seen those pictures, it might be HS. I really enjoy, giving those grand round lectures and also having the opportunity with like the American Academy of Family Practice to do lectures like with that group. Because again, like I said, there's so much dermatology that primary care doctors are being asked to do. And like I
Hmm.
teach them and I know that they get like a week in training, right? If they're lucky, they get a full week of
Wow.
training with me. And that's so much considering that they have a whole lifetime, of primary care ahead where the derm questions are just going to keep coming. And so we also try really hard to make it easy because that's another thing is that it's tricky to get into dermatology. And I know that we do not have enough dermatology providers for patients that need them, and especially when they have inflammatory skin conditions. And so we always make sure that we prioritize patients that are being referred for things like HS or atopic dermatitis, psoriasis, vitiligo. And also, I want to make sure that those patients that are suffering, when we can get them in off the wait list and when we can see them sooner, that we always do. I think a lot of dermatology sometimes ends up going to urgent care or the emergency room because of long wait times. And so anything that at least I can do in my small world of ARIA comprehensive dermatology, we try to do.
I love that. So you've been also recognized for community work with your free skin screenings and advocating for health policy changes. So can you share some of the impact that you're making in some of these initiatives?
The free skin screenings, I think, are just such a great way for someone who's never had the opportunity to interface with a doctor before, or dermatologist, to just get checked. And so I partner with Chicago Public Schools and with some like local gyms in the area and with the triathlon and with the Chicago Marathon. Sometimes it's just me, and then sometimes it's me with another organization like the Women's Derm Society for like the triathlon, and we do skin checks checks, like when you go in and pick up your packet, and you have all the different booths and you can get your Gatorade gummies and you can get all of those things. And you can just pop over and get a skin check. And so we'll often have a couple dermatologists there. And we found a lot of, very atypical moles. I found basal cell. I found a couple melanomas. I always say the most important thing that we can do for our patients is make it easy for them to do the right thing. And so by being where people are, it just allows that burden to be decreased for them to just be like, oh, I guess I'll pop by. And then sometimes, of course, it's the other half where I have the wife kind of like dragging the husband, by the shirt sleeve of like, I've been telling you to get this checked.
Yep.
And generally, she is right. But I do a lot of those screenings. And then throughout the month of May in my office, we do 1 day a week that's all free skin cancer screenings for anyone in the community to come into the office. And so I'm not unique in this. A lot of dermatologists do this and do these skin screenings. Just am a real advocate of patients taking advantage of them.
Yeah, I love that. And so I also saw that in 2014, you were the first dermatologist and youngest physician to receive the Ohio Physician Advocate of the Year award. Congrats on that. That's amazing.
Thank you. Thank you. That's honestly, that's one of the biggest honors I think I've ever received in my life because it was my colleagues, right? And also we did something that meant something and it was really
Right.
hard. And I was working on this like all through residency in medical school and having that opportunity to advocate and build relationships with legislators and lawmakers. And it was a huge honor. It's something I'm super proud of.
Yes. I mean, you should definitely be proud of that. That's amazing.
I will tell you a funny story though, is when I was prepping. So one of the pieces of legislation that I was working on during that time in advocacy was indoor tanning legislation. And so in the state of
Mhm.
Ohio, as children, you were just allowed to like go in and sign up and like use a tanning bed. And we know that, tanning beds are level 1 carcinogens, the same as like arsenic and things that we know cause cancer, as we know exposure to tanning beds can cause cancer. Yet tanning beds were classified as the same level of device as a tongue depressor.
Really?
Really, this is a
Wow.
fact, yes. And so just the concerns were not understood. I did a podcast actually for someone once, and when it was like, the dermatologist who used to go tanning, and like that's me. Like I raised my hand, and
That
because
was
when
me
I
too.
was younger, we didn't, right? I mean, you just
Mhm.
didn't know. And it was
Right.
promoted as like a healthy glow. When you're an adult, make your own decisions. But when you're a
Mhm.
child, it's very important that we help parents make decisions. And I know that my mom at least was like, well, she's not doing drugs and she's not, doing anything crazy. If she wants to go tanning, how bad
Mhm.
could it be? It says it's healthy.
You know what? It's crazy because I remember I used to go tanning. I would always think of it as this is my relaxation moment. Like I'm
Hmm.
getting a little bit of energy from going tanning. I don't know where that logic came from,
No, it's
but
actually very true. It's
yeah.
addictive. There's absolute neurologic data on like the addictive patterns of UV tanning in tanning beds. And what you felt were endorphins released, during that experience. And my girlfriends from high school, we still joke about like how good it would feel. And like we have to like talk ourselves off the ledge, because it would
Hmm.
feel so good. And also, it's why like we have more wrinkles than we should at this stage in our lives, why we have more brown spots, why we have a higher likelihood of being diagnosed with skin cancer. The indoor tanning legislation that we passed during my tenure, and then we worked on also prior authorization reform, which I know you do a lot of work with in access and helping make sure that medicines are accessible to patients. One of the most difficult things that we experience between the doctor making the decision that a medicine is needed for a patient and then the
Hmm.
patient actually getting that medicine, I mean, it's just the craziest ride.
Yeah.
And it is the furthest thing from a direct path. And what we were finding is that payers, meaning insurance companies, were requiring prior authorizations, but not really giving criteria on when a prior authorization was required or what was required to be included for a prior authorization. And then we also, through this legislation, asked the question, if a patient with X condition with Y criteria gets a medicine approved 99% of the time, does the doctor's office really need to go through all of this paperwork and all of these hoops to jump through if 99% of the time you're eventually giving the medicine? Because I know what it feels like to me and feels like to you and my colleagues in dermatology and my colleagues that are PAs and NPs in dermatology, is that sometimes it's just a battle of persistence. If we can just keep going and keep, saying the same thing, that eventually our patient will get the medicine. And so that was some of the most important work that I worked on in that advocacy initiative, was trying to provide more transparency to prior authorization and provide prior authorization reform so our patients can get the medicine that they need, and very importantly, in a timely fashion, and not with retroactive denials from procedures and things like that we see. So you and I could go on a deep rabbit hole down that one.
Oh, I need a whole nother podcast episode to talk to you about this, because
I know.
it's still needed today.
It's still needed, exactly. And I really appreciate all the work that you've done with educating, offices and providers on just the different ways to make sure that our patients are getting the medicine and the patients understand the medicines that they get and the choices that they have. That's so critically important, and was a niche that you filled very well. So thank you.
Thank you. So, what advice would you give to dermatologists or even residents or other healthcare providers who really want to engage more in the advocacy and public health side?
My answer is just start where you are, like where you're seeing something happen in your practice. That's the best place to start. What's the part that just like makes you so annoyed that you have to do this again? What's the thing that is getting denied for your patient that just doesn't make sense to you? What's that condition like vitiligo? I just learned last week that there's an insurance company, UHC, that has decided to consider vitiligo a cosmetic condition. Vitiligo is not a cosmetic condition. It is a
Right.
medical condition where the immune system attacks the pigment producing cells in the body, and it is not a cosmetic condition. And anyone that would say that is just completely not informed. And so I'm going to give UHC the chance to walk this back, because my guess is that they must have gotten some bad information or some bad data, because it is a very poor choice that's really going to impact patients and patient care. And this is also something that's really important when we get our patients involved, right? Because when you see this happen to your patient, that's the part that like makes you angry, and like use that angry and use that anger and annoyance to kind of fuel you. And then also bring your patient along. Ask them to come with you and say, like, hey, I'm actually going to call your insurance company, but I need you to too, because the patient is the client of the insurance company. And they need to know, not just from us, not just from the dermatologist, that this is a problem. They need to know from the patients that this is going to impact their care. And so my first thing is think about those things that really push your buttons, that really are, systemically that you see being problematic. And just ask yourself in your head, what's the one next best step? Just one step, not how do I solve this problem across the country, but what's one thing that I could do today? Sometimes that one thing you can do today is just sending a note, an email to the American Academy of Dermatology and saying, I'm not sure if you're aware of this, but my patient with this insurance was just received a letter and told that their vitiligo was a cosmetic condition. And the excimer laser that we used to be able to provide that was giving them great results. And for the first time, they have pigmentation now. Are you seeing this anywhere else in the country? And like that takes 30 seconds, right? And I know none of us have an extra 30 seconds, but we do. And we do when it's important, right? And so you don't have to call the head of UHC and schedule a big meeting and just make that one step, or call me, like
Mhm.
send me an email, send me a text message, and tell me that this happened in your practice. Because when there are those of us that take advocacy and like love it so much that we're willing to drive to Springfield, Illinois, or to drive to DC and testify about these things, I need your stories. I know how it impacts me and
Right.
my patients, but it's much more powerful when I also know how it impacts you and your patients. The other thing from an advocacy standpoint is not all advocacy is legislative. Advocacy is just in your community. And so, something that's really important to me from an advocacy standpoint of helping patients understand like seriousness of skin disease is providing this free skin cancer screenings, and anyone can do that. It doesn't have to be a full day. It can be whatever you want it to be, but just doing something, and
Mhm.
find out what that something looks like for you. And then consider joining one of your societies that has an organization, whether it's the American Academy of Dermatology, whether it's the SDPA, whether it's any organization that, has the advocacy that you're looking for on behalf of your patients. Maybe it's joining, the volunteer organization for the National Psoriasis Foundation. Maybe it's joining the Global Vitiligo Foundation. If what I've said has
Mhm.
really ticked you off about, like what's happening to our vitiligo patients, then like look up GVF, the Global Vitiligo Foundation, and see if there's a way that you can volunteer. The National Eczema Association also has a lot of opportunities, to interface. And then something else that I do in our community is I work with some women's shelters, and that's on behalf of a program that we do with the Women's Derm Society. We have a shelter initiative where we go into shelters for women that have experienced domestic violence and give them education, because often when you're leaving a situation like that, you don't pack, right?
Right.
You're not taking
Mhm.
often all of your things. And there's a lot to process there mentally, often physically, emotionally. And sometimes you just want to sit around with some other girls and talk about skin. Right.
Yeah.
And so how this started for me is I started doing these programs where we just talked about like healthy winter skincare and like, okay, how skincare should change in the summer. And now that I've been doing it for a few years, we're actually working with them to develop a free clinic that would actually happen inside the women's shelter. And so that's something I'm really excited about. And we had another meeting about it this morning. And so it's not an easy endeavor, but I'm very hopeful because now that I have such trust with these women and now I see them pretty much every other month, they have real medical problems and they're on,
Mhm.
and it's hard for them to come see me in the office. And so I think engaging in advocacy and engaging with your community in any
Mhm.
way is the right way. And we also do a program that's Walk with a Doc one Saturday a month where we meet at my office and it's random who shows up. Sometimes they're patients, sometimes they're not. And we just take a walk. And in the wintertime, we do it inside the like Amtrak station and walk around the Christmas tree. And then like people just ask me questions. And it's
Mhm.
a way to kind of like get together with a doctor that's not so formal. And it's also good exercise. So yeah, we like to
I
do
love
that. So
that.
those are just a couple of
That's in
things.
Chicago?
Yes.
Okay, well, I'm in Columbus. I'm gonna have to make a
There
trip.
could okay, you are
That
invited.
would be
Anyone is
fun.
invited.
Right. You had
Most people.
mentioned NPF, National Eczema Association. What about for HS?
But yeah, the HS Foundation is a great organization. And there are some like spin-offs, of different organizations, but the HS Foundation is an amazing organization. And they also have different support groups and different resources and
Mhm.
provide different webinars. And shout out to a huge HS advocate, Jasmine Espy, who I know and love and is such a voice and light in the world for patients that have HS. And she's just wonderful. And I get to work with her on different initiatives for HS and has been just such a great advocate. And so, finding also a patient who really elevates their voice is something that I think is so important to celebrate.
Yes, absolutely. I love that. Might have to get her info and have her on the podcast.
Oh my gosh, she would be wonderful. She would be such a great guest for you.
Yes. Well, I really appreciate this time. This has been so enlightening. It's such a great conversation about all that you have been doing and working on. And I just want to know, like, what do you do on your time off? I mean, do you have time off? What do you do to keep yourself rejuvenated and unwind after a long day?
So I am very lucky that I have an amazing fiance and he is the chef in our home. So that is something that I think would make my life so much harder. Not only is he a wonderful human, but I don't have to think about food.
That is amazing.
But for me, it's just exercising and connecting with friends. Those are my like two sources of rejuvenation. And I recently sprained my wrist and sprained my ankle, which come on, but now I'm working with a trainer a couple times a week. And that's how I like to start my day. And it really kind of gets the ball rolling. And believe it or not, like doing these kind of things, like I love doing our shelter initiative and like that brings me a lot of joy. And also I'm super excited that tomorrow is Saturday morning and I don't have any early calls. I don't have an advisory board to do. I am just going to enjoy and have my coffee as slowly as I like it. And then I'll probably sneak off to a Pure Barre class in the afternoon because I love some Pure Barre action. But yeah, I just really love just connecting with humans and keeping my body moving and like not having to think about food. It probably feels so funny to hear me say that, but like, I think it just occupies a lot of our brain, right? And so when we can do things where like, there's some things I'm really good at and like, basically that's like three things. And Alan, my fiance, is good at everything else. And so, I think having a good team makes such a difference because my team at the office they're not just my clinical team. They're also helping me get prepared for when I'm going to the women's shelter. They're helping me get prepared when putting together baskets for, HRC charity raffle, like a human rights campaign for, their gala or, something like that. And so there's always something to be done. And so surrounding yourself with those people that bring you joy and align with your vision and your mission, I think to me, that's what's allowed me to have the opportunity to do all the things that I do, because I guarantee you it is only because I'm supported. And so if anything, I think it's looking at what are the things you're exceptionally good at that you just have to give to the world. And then what is everything else in life? And what of those things can you delegate? That to me is the secret sauce, as well as get a therapist and get an executive coach.
I love it. That's such good advice. Thank you so much.
I love it. Thank you so much for having me and for creating this platform. It was a pleasure.
This episode is sponsored by Dermavant. Thanks for spending a few minutes with me and listening to That's Derm Good. You can expect new episodes of That's Derm Good every week. The podcast is available on your favorite app, including where you're listening right now. Subscribe to the podcast so you never miss a new episode. Bye.